Good morning. So, we need to understand a few things about asthma, and I'll put it in a few minutes. First of all, you need to understand how your lungs look like. And I'll just direct you to my laptop here, and you can see this is the lungs. This is in our chest, like two sponge bags full of air, and a tree, which you can see the red airways. The airways are like a tree turned upside down. The trunk is here and the branches go into both our lungs. The trunk of the tree, which is in our neck, is pretty wide in diameter and firm cartilage, so this doesn't narrow. Otherwise, we would drop dead. It's the branches that you can see, these red branches here on both sides, that tend to narrow. And that causes the problem that we face in asthma. Now let's magnify that branch, and if you magnify it, the branch looks like this breathing tube model that you can see here. This is how it looks magnified. And as it gets narrowed, it looks like this. And so you can see now that there's more narrowing, and as it gets really bad, when a patient comes with a severe asthma attack, it looks like this. And so you must understand from this that the problem in asthma is in the airway, which is the branch that you saw. And this gets both narrowed in the sense the muscle gets tight around it, and there is swelling inside the airway and mucus that forms. Now, this swelling and this, which is red in color, and this mucus and this short-tempered nature of the airway is all in medical terms called inflammation. So the one word you would use for it is inflammation. And inflammation, to get back to normal and to get treated, needs an anti-inflammation drug. And the most potent anti-inflammation drug in allopathy is steroid. Of course, with steroid, this will all come back to normal. But remember that steroid has a lot of side effects in the tablet form. And so you need to know all the side effects of steroids if you take a tablet steroid every day. But the good news is that you need that steroid tablet only for an acute emergency. For regular treatment, you need steroid on this airway so it comes back to normal, but in a much lower dose, 40 to 50 times lower dose through an inhaler. And so the steroid inhaler is our mainstay of treatment of asthma. For patients with regular asthma, we give it to them regularly, and for those with milder asthma, they may just need a steroid as and when required. And these steroid inhalers also have muscle relaxants, which is the bronchodilator, in them, so that you can give both the drugs acting immediately, need-based. And if it's a little more than mild asthma, you may need these drugs in a low dose regularly, and as it gets more severe only, which is a small percentage of asthma who need a lot more medication regularly. In those patients, you may need more than a steroid and dilator inhaler, a few tablets as well, and biologic treatment. So that's a very small percentage, about 5% of all asthma. Most asthma can be managed with an inhaler that treats the inflammation and treats the muscle spasm around the airway, and you should be fine. It's an easy disease to treat if you understand what's happening in your airways. Thank you.